if we're thinking about autoimmunity as a potential problem, the question is, first off, how did it get there? So we now have this concept of autoimmune encephalopathy of infectious etiology. So this is where infections actually turn on the immune system, or the acquired portion of the immune system specifically, and it goes rogue. So if you think that the problem is the bug, you have to go treat the bug. All right? First and foremost, you've got to go after the underlying infections. But in strep infections, such as with pandas, but in Lyme disease, we also know that it can do this. We also know that Bartonella and Borrelia are capable of turning on the acquired immune system. And we know that it's capable of turning it on in such a way that then starts to attack itself, this autoimmunity that occurs. So in order to effectively treat these people, we have to treat not just the bug, but we also have to treat the immune system itself. And so the Cunningham panel becomes crucial in my workup of these people to find out how much of an autoimmune process I've got going. Because if all I've got going is bugs, it makes my life much easier, right? Go kill bugs, viruses, whatever it is we need. But if the problem is autoimmunity, then I know that I've got to do work on both addressing the underlying infections, be they viral or bacterial, but also in addressing the autoimmune process as well. But the problem is there are so many receptors that we don't check all of them. The nice thing about the Cunningham is that it's identified those receptors specifically in the pandas population that turn out to be equally valuable in the adult population. And we can use it not just for treating the children, because basically the cutoff is at the point they become adolescents. But the reality of the matter is this is a disease that we see progressing well into the teens, the 20s, the 30s, and 40s for that matter. And so we use the molecular to get a couple of different pieces of information. One is the CAM kinase giving us some indication that there is an ongoing infection that's still in the person that we have to address. The second is what antibodies are in fact activated. And again, the Cunningham isn't necessarily the only thing we'll run. We'll look at ANA, we'll look at the Mayo Clinic panels to make sure we're not missing other things. But we know for certain, at least with the Cunningham, as part of the tools we're looking at, we haven't missed anything as best we can to date.